You're listening to the Nourished Child Podcast, episode number 10, How Play Therapy Can Help Your Child, with Jackie Flynn, registered play therapist. Kids may experience difficulties in their childhood and need extra support to work through challenges such as picky eating, behavioral challenges, and even an eating disorder. Today's episode highlights the role of play therapy in helping children sort out and communicate their emotions, no matter how challenging they are.
Welcome to the Nourished Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Hey there, Jill here, and welcome to another episode of The Nourished Child. For your information, this episode can be found on jillcastle.com/010. That's jillcastle.com/010. 010 for episode number 10. There have been many times in my career when I've focused and worked with a therapist on behalf of a child. When I had my practice in Nashville, I can tell you I worked with some real rock stars when helping children and teens with disordered eating and eating disorders. But making the decision to pursue therapy for a child can be a hard one for families, and it isn't a decision that is easy for some families. I wholeheartedly believe in the amazing healing a good therapist can bring to a child. And that's why I wanted to interview my friend and therapy colleague, Jackie Flynn, on the Nourished Child podcast today. Jackie is a licensed mental health counselor, school counselor, and registered play therapist. She specializes in helping families with issues such as behavior management, relationship struggles, motivation struggles, ADHD, autism, blended families, adjustment to divorce, and eating disorders. Today we're going to talk about play therapy, what it is, who can benefit from it, what goes on in a play therapy session, and how play therapy can help children, even teens, with any kind of troubling challenges in their life. We're going to hear how Jackie is taking play therapy and helping treat eating disordered patients. So without further ado, let's tune in. Hey, Jackie, it's Jill. Thanks for being on the show.
Hi, Jill. Thank you so much for inviting me. It's definitely my pleasure.
I am so excited to talk to you. I don't know if listeners understand your role in my podcast journey, but Jackie, you really inspired me to get going on the podcasting. So I am just delighted to be able to have you here on the show and to really talk about play therapy and what it is that you do, because I think there's a lot of parents out there that would love to understand what play therapy is all about. So tell us a little bit about you first and then what you do as a play therapist.
Oh, thank you so much, and thanks for your kind words. Well, I'm a registered play therapist and also a licensed mental health counselor in Central Florida, and I just love working with children and families, and just recently I'm delving into the work with couples because I wanted to complete that full family holistic approach. Mm-hmm. But really, through the play therapy process, I work with kids on a level that really kind of meets them where they're at. I have a play therapy private practice with like a really cool room with some expressive, nurturing, aggressive toys, and just go in there and the children use their play and the toys for their words. And it's not necessarily a method to get them to talk. Mm-hmm. Of course, they do talk in there. There are some verbal communication, but the actual healing comes through the play, because when children play, it's essential to like their cognitive, their social emotional, their physical development, their feeling of confidence. They can really feel free to let loose with their like curiosity and their problem solving in a way that's developmentally appropriate. And I also use that with the parent-child relationship as well, but I use it with many adults too. It just looks and feels a little different through sand tray therapy.
Right, right. So I'm sure you're seeing a wide range of emotions, from happy to sad to angry to frustration. I mean, what are you seeing when you're seeing children sort of act out their emotions through play?
Well, it's usually a few different things. Certainly acting out can be something that's quite frequent, where you see a parent will bring their child in after some problematic behaviors at school, maybe some aggressive type behaviors, or at home, some back talking or oppositional type of behaviors. But also there's the acting in, and they take it in as, I'm a bad person, or I'm not good enough, I'm not smart enough. So it can look very different depending on what's going on for the child and what their environment is, as well as, you know, how they're responding to it. But it can be really painful stuff, and through that play therapy process, you can really kind of help them in a way that's not reliant on words. And I couple it with EMDR therapy as well, which is a way to really use their brain through bilateral stimulation, their whole brain, to help them process through that tough stuff, whether it's divorce or whether it's grief and loss or a learning disability. Sometimes kids that have some neurodevelopmental disabilities, autism or ADHD, they will present with some feelings of like, I'm not good enough, I can't do this. So that play therapy, especially when I incorporate the EMDR, can really get in there and help heal those, we call them cognitions, and reprocess them into, I am good enough, I'm worthy, even if it doesn't come to the level of words for kids, because I work with kids as young as, you know, like 2 and 3 years old. You get that feeling of self-worth in there, and it really lays those tracks in their brain for future learning, future development. It's really good stuff. I love it.
Really sounds so interesting. And what, you know, take me through like an example play session, a therapy session. What do you do with the children? Is there a process that you use? Is it child-led, or are you leading it, or are you more of an observer? I'm just curious as to sort of what that whole session is like.
Well, it varies from, you know, session to session and client to client, but I'm trained in Adlerian play therapy and client-centered play therapy, or child-centered play therapy. So in the beginning, that relationship is so very important. If there's not a strong relationship with the child, then you don't get much meaningful work done. So really focus on that relationship. So there's a lot of tracking the child's play through, like, really kind of being one-on-one them, letting them know that they have 100% of my attention, and I reflect their feeling, I reflect what they're doing through statements of, you feel really frustrated, or that's something you know how to do, or some words like that, just to let them know that I'm with them. Now through the Adlerian play therapy, as the sessions progress a bit, then that relationship is really strong. Then you can start to challenge the behaviors in a real soft, gentle way, saying, well, I notice this is something you really value. You really value friendship, and you really value having fun with your friends out in the playground. But I notice that you do this, and it may be like throwing sand on them or something, and just kind of put it out there in a real nice, gentle way, and it helps them work through those problematic behaviors. Now, of course, that would be an older child, perhaps a tween or adolescent, that I would speak like that to. With younger kids, through the puppets and through the little miniatures, you act out the scenario, and you can do that with older kids as well, and that can really kind of build that understanding on a deep way that doesn't feel like, hey, somebody's lecturing me or I'm defective in any way. They just kind of learn it through the play, so it goes on a really deep level. So we go in the playroom, and I say you can play with these toys in this room in almost any way that you would like. So it's different than the normal, just playing with a kid. The child actually chooses what to do, and you set limits. Of course, like if you have paint, you would say something like, if they started to spill the paint or paint the paint's not for putting on the walls. You could choose to paint the paper with the paint, or you could choose to play with something else. So there's good opportunity for limit setting, reflecting a feeling, that connection building, as well as that therapeutic process of just identifying new ways to problem solve.
Yeah, I think in my own practice, that whole, I don't think any quality good work gets done unless you have a relationship with either the parent, and in my case, oftentimes I'm working with the parent, or with the child. I mean, and there's so much time involved in getting to know your patient and getting to trust your patient, and your patient trusting you. And when you have that all set, then the real work starts to happen, wouldn't you say? Or I find that for myself anyways.
Oh my goodness, yeah. They actually have some research that shows that the therapeutic relationship is the biggest indicator of success, rather than, like some people say, there's a certain type of therapy that they provide, this is more effective than this, but when in actuality, it ends up being the relationship, which is really cool. But that relationship with the parent is vital. So like as part of my practice, and it varies from counselor to counselor, but I spend 60 minutes with the child, like in person, and then during the week in between sessions, I like to spend 30 minutes on parent consultations. Hopefully every week is ideal. Sometimes schedules don't allow, but then when you have that continuity of care, and you can really kind of find out the parent's concerns, address your concerns, talk about therapeutic progress, or maybe some things that are impeding the progress. And that may look very different from family to family. If you have a family that is divorced, you may need to do a conference call, or if there's high conflict, speak to one parent for 15 minutes, then call the other parent for 15 minutes, that type of thing. So yeah, that parent consultation, just like what you were saying with your work, is a biggie.
Well, yeah, if it's hard to help the child if the parent's not on board, or understanding the process and what goes on. And I'm not sure if you end up doing much with just helping them parent. I know that I do, in terms of parenting around food, setting limits, setting boundaries, all of that sort of stuff. There's a lot of just coaching the parent in terms of how to respond to their child, and what the best, most positive responses are, and oftentimes also pointing out what the negative responses are and what doesn't work, and to how to avoid those things.
Exactly. Yeah. I definitely talk to the parent, about parenting strategies. And ideally, I love to provide sessions to the parent as well as the child. There's a type of therapy called child-parent relationship therapy, and I absolutely love it. It's a 10-session model, and it's developed by three of the big gurus, 3 or 4 from play therapy. But it's called CPRT, child-parent relationship therapy, and some people refer to it as filial therapy, like FILIAL. And you really just focus on, each session has some rules of thumb, and you focus on connecting that relationship, but all the while teaching the parent to set limits, and how that sounds, how it looks, really teaching them to connect with the kids. For example, like the first session, one of the big rules of thumb is focus on the donut, not the hole. So really kind of given that mindset shift of really focus on what's going right for the child, what's the strength, and then focus on your needs, but don't make it a big, about all their problems, because that's pretty tough,
Yeah.
And then like another one is be the thermostat, not the thermometer. So while your child is getting really upset and heated, if you get upset and heated and angry and all those big emotions at the same time, it just makes everything kind of escalate. So to be the thermostat to just kind of dial it down and set the temperature in the room. And little tweaks like that can really change family life in a big way.
Mm-hmm. Mm-hmm. Yeah, I can see how that would be so very important. Now, I know that we were talking a little bit earlier about the different types of clients that you see, and I know you see really young children and up through teenagers, but from a nutrition standpoint, since this is a childhood nutrition show, if you will, what types of I'm curious, what types of conditions or are you seeing in play therapy as a play therapist that might also have some nutrition concerns wrapped around in it? I know you mentioned autism, and certainly there are some nutrition implications and nutrition management that goes along with autism. But I'm curious, are you seeing play therapy used in any other conditions such as, picky eating disorders, weight management, anything like that?
Absolutely, and that's why I invited you on my show, because that picky eating or overeating, any type of nutritionally based stuff is definitely part of childhood. And, personally as a parent, I have a picky eater, so I was like hanging on every word that you said. But with my clients personally, and professionally, a lot of times their concerns around nutrition, I find a lot of parents that have children that have attention deficit disorder are looking for ways to help their child focus. Mm-hmm. And there's a really good expert right near me in Orlando, Florida. He's a play therapist. He's not a play therapist. He's a child therapist, I believe, Jim West. And he has some pieces on that nutritional element, how it can help kids with attention deficit disorder. But more recently, I've gotten into helping clients with eating disorders. Mm-hmm. So, mainly adolescent teenagers, females mostly. And I'm just starting up a group here in October 5th in my area, Reshaping Body Image Art Therapy Group. So we're going to be looking at, and now I don't do the nutritional piece myself because I don't have the expertise that you do. So I really kind of use nutritionalists and dietitians, and as well as physicians, as part of our team for that continuity of care. So when I work with my client, I ensure that they have it. If they have a eating disorder, such a serious thing, that you want to make sure that I'm not the only one on board, because the nutrition isn't my area of expertise, but it's certainly a really big area in terms of the not only physical wellness but emotional wellness of the child or adolescent. So we do have a team. I work with the emotions and the psychological wellness of the client, and then the nutritionist will help with the eating plan, and then the physician will work with that child's health and kind of determine, hey, is residential treatment necessary to help to get them the nutritional intake that they need. And all throughout that process, we kind of communicate when necessary. And I love when I hear my clients talking about their nutritionalist or their physician, because it's so exciting, because they it feels like we're all working together, and then they get that message of, hey, I have a whole team on my side.
Oh, sure. Yeah. So when you do, I'm curious about your course coming up on body image and art therapy. So tell me a little bit about that. That sounds really interesting, because body image is, gosh, even if you aren't somebody who is challenged by an eating disorder or disordered eating, body image concerns are surfacing quite a bit more. And even in the media, just on social networks like Facebook and Twitter, there's just been a lot of talk about body image and body positivity and self-love, and it's really I'm noticing a real trend towards helping kids, grow up with a healthy body image and a healthy relationship with food and all of that stuff. So I'm curious how you approach play therapy or art therapy when you're working with somebody on body image.
Yeah, and my group's starting. I'm so excited about it. So I'm going to tell you about my group. But before I say that, I just want to say that what you said about how the body image and the media and everything, that's why we are so lucky to have people like you out there, especially with this podcast, because I don't even know if anything like this is available yet to where we can kind of put this out there in a large scale way to where anybody can have access to it. So I really feel grateful. But my group coming up, it's an in-person group. It's through my private practice. And I love art therapy. So we're going to be doing, it's an unconventional approach. When I work with with my clients with eating disorders on an individual basis, it's a type of therapy that desensitizes certain cognition, certain thoughts, and reprocesses them. And I've been having really good success with the feeling state protocol. So it sounds like a bunch of jargon, but I incorporate art therapy in there, and it really uses the whole brain. Whereas when we just talk, it's just using our prefrontal cortex, so we're limited to words. And with eating disorders, a lot of it doesn't feel rational to the client, and it doesn't sound rational to other people, but it feels very real and very painful. And the biggest thing that I've noticed is around body image. That seems to be where it's all based in that fear of, and when I'm thinking about like anorexia or binging or purging, restricting calorie intake, it's all based in that I'm going to be overweight. I'm going to, you hear the word fat in there, which I'm not a big fan of, but that's like a big fear. So through this reshaping body image art therapy group, we're going to be it gets a little messy in there, but I love it. We're going to be working with paints and sands. I have sand tray with little miniatures, and we're going to be working with clay, music therapy techniques, and I love rocks. We paint the rocks. We look at different elements of the colors and how they relate emotionally. We're going to get into poetry, and we do that, like that's the art piece of it, but the therapeutic piece of it is done through the art projects will all kind of be around the focus of mindfulness, which mindfulness, like mindful eating, mindful thinking, mindful doing, can put you more in the present. So it takes you out of that what if or that I should have. And when you get into the present and not into the past and the future, then things are much, much better. Then we're going to be looking at coping skills and then somatic experiencing, and that's really just really getting in check with how your body feels about certain things. And that's one of the biggest indicators of, if somebody's getting better throughout this therapy is how they feel in their body when they think of certain thoughts or memories. And we're just going to integrate that in there, and we're going to focus on self-compassion, wellness. One of the biggest things with the eating disorder, though, the fear of recovery, because it's one of those things, like when you think, well, I want to recover, I want to be healthy. That's what you would think, from an outsider's point of view. But from somebody who's really struggling with it, recovery may mean their worst fear. It may mean being at a weight that they don't feel comfortable at. Yeah. And it may to us say, no, that's a healthy weight, but in their own body, they may not feel comfortable. So there's that fear of, if I recover, that means I have to be like that. That can be painful. Sure. And then we look at values, relationships, and their dreams and aspirations is a big key piece of it, because with eating disorders, you really have some risk of big health issues, because you can mess up your metabolism, you can make it to where certain body functions don't work as well, or so many different drawbacks, especially of the binging and purgings, as well as it can make you, really physically ill to the point of sometimes even death, So looking at those dreams can help people get more into the bigger picture and out of that feeling of like devastation.
Right. It's so interesting that you mentioned, in the outside world, we all might look at somebody with an eating disorder and say, well, life is so much better at a healthier weight. You're just going to be, so much happier. You're going to be able to do all the things you wanted to do. This is really holding you back. But what what I think people don't realize is that changing, an eating disorder is sort of that safe zone, that comfort area. That's where they live now. That's where they think their thinking is revolving around that. That's their safe zone. And so changing and leaving that behind is such a hard thing. So for so many young people who are challenged by an eating disorder, and I've worked with many young teens as well, and that that getting better has to come from within. And so I'm really interested in that aspect of your work because I think it really does shine. You said something that really struck me, and that was art therapy really is accessing a different part of the brain. And one of the things we do know about individuals with eating disorder is that their brain is not functioning properly on many levels, cognitively anyways, because of starvation. And so that really struck me because you're accessing, a whole different part of the brain. And traditionally we've done so much talk therapy. Nutrition therapy is often talk therapy. Psychological counseling is often talk therapy. So this art therapy aspect or play therapy, approaching it from just, a way that you're accessing a different section of the brain is so interesting to me.
Yeah, it is absolutely amazing. And before I got into this work, I had no idea that this was even possible. But when you really kind of look at the neuroscience of it, we have a part of our brain called the limbic system, and it really feels those emotions in a really deep way. So a lot of times we can think one thing, but our unconscious brain thinks another thing. It's like our conscious and our unconscious brain are in conflict. I learned that in my hypnotherapy training too. So it's important to really heal on a more holistic level for especially some of these bigger things because they're not surface level. They go really deep, and it's way beyond just telling someone you should do this, you should do that, because then and it really that damages the relationship. They don't really need a lecture. They need healing.
Well, you do such important work. The other thing that you said to me that I thought was just beautiful was the fact that you use rocks. I mean, rocks are all different shapes and sizes and weights. I love that. I love the idea of tying a rock to body image and a lesson around body image using rocks. I think that's incredible. I never thought of that before. It really spoke to me.
You can do so many things with rocks. You can even get into metaphors in a big way. I did a presentation at UCF with Dr. Munyon on 4D metaphors, and we had like the metaphor between a rock and a hard place, and you actually have the client use the rocks as a tangible, hold them in their hands and really explore, what's common about a rock that is common in their life, and it takes them to a deeper level. But like the metaphor of, like out in the ocean where there's these big giant rocks and there could be the biggest of storms, and even during the midst of the giant storms, that rock is still in the same place or very close to it. So really kind of exploring that security and stability. And a lot of times when there's an eating disorder present, that's just part of what's going on for them. So it helps heal other areas that may have led to that. And through research, we know that we have like when we experience traumas, and trauma can definitely lead to different things, and certainly could lead to people having an eating disorder. But you can have a trauma that holds emotional memories that can really cause you to respond in a way that's based off of fear and anxiety, or this I'm just this way, kind of labeling yourself. So that trauma can hold itself from 6 months in utero. So even though, like, for example, I read this one study of this family that was involved in domestic violence, and one of the questions posed was, which child is healthier, the teenager, the toddler, or the baby? And most people probably think, well, the baby, because they're not going to remember it. But actually, the baby is the one that's most likely at risk, the infant, because there's not that cognitive memory to kind of pull on as things go wrong, and child, if they make it to therapy, to be able to touch on. They may just be acting out in ways that they can't quite put their finger on. So that child may have those pre-verbal emotional memories stuck in their limbic system. And through this type of therapy, art therapy, EMDR therapy, some of these somatic experiencing, these real body-based whole brain approaches, you don't have to know what happened. You don't have to have an explanation. You can heal even those intergenerational traumas that really go deep. It's super cool. Wow. Super. I could talk about it all day. I feel like I'm talking your ear off.
Well, I'm very interested in it too. It's really interesting to see how it can be integrated in the work that I do, and that other therapists, other dietitians and nutritionists out there, how they can integrate play therapy and art therapy and find, a professional such as yourself to refer their patients to, but also for parents who are listening to this program. I mean, you can help children as young as 2 all the way up through adulthood, it sounds like, with play and art therapy, with very minor things like complaints from school and acting out at school, to helping children focus more if they've got behavior or learning challenges. Yet you can also use this for much more serious conditions. And you're just such a wealth of knowledge on this, and such a great resource for parents and professionals as an option to really just, as you say, treat the whole child, really making sure you're coming at that child from many different angles to help them.
Yeah, and you can even help a kid, like emotionally, on a mental health, from a mental health standpoint. Infant mental health is what it's called, 0 to 3. So really kind of, even that little tiny infant, you can help them through those types of therapies to move through things, so they don't have to be impacted from them their whole life.
Well, and I think the other thing too, Jackie, is that, a lot of parents that I work with or have worked with in the past, or just even friends and colleagues who have kids who are having whose children are having troubles, they get this, there's a stigma about going to a therapist or going to a psychologist. And I think that, play therapy or art therapy is something that can be, it sounds like anyways, just as effective, with perhaps even less stigma.
Yeah, and it's fun.
Exactly.
And I remember you mentioned playing with your food, and how sometimes that could be beneficial, letting the kid kind of just explore and really be comfortable without that rigid approach.
Yes.
And I think that's huge. That can make the difference between whether the child eats vegetables or not, and it really associates that, hey, this is an emotionally safe environment and I'm free to kind of explore in a safe way. So they're going to be more likely to respond to that healthier food than they would if they were forced.
Right, exactly. And we, as you know, we've talked about this in the past too. We live in a society that is very clean, and we like our babies to have clean mouths and clean hands and clean clothes. And that, really, I personally love to see babies slathered in yogurt and food, and just in really enjoying it, because the sensory aspect of just digging in and feeling food from a tactile standpoint to the benefits, as you mentioned, that, just really getting completely whole body experience with food really can desensitize kids with food fears, and can help them, as you said, be less picky and more adventurous.
I wish you lived close by.
I know.
I could...
We'd have a rock star practice.
But you are amazing. I'm so happy that this podcast is out there. Thanks for doing this.
Oh, well, thank you for being on the show. Tell my listeners where they can find you, where they can find your podcast, because you are an awesome podcaster yourself. And Jackie's podcast, everyone, is called Parenting in the Rain, and it's a fabulous podcast. But tell everybody where they can find you and how they can listen to your show.
Sure. My podcast, like Jill said, is Parenting in the Rain, and you can find that at parentingintherain.com. I'm at the time of this recording, I'm on episode 35, and I have a variety of different things that I cover, such as like social emotional. I talk about how families of divorce, divorce recovery, as well as some couple stuff. I'm a marriage counselor, and looking at labyrinths and parent depression, anxiety, kid anxiety, all of that stuff, emotional abuse. So you can find me at parentingintherain.com, or you could email me at JackieFlynnConsulting.com, and I do some parent coaching as well.
Awesome. I will include all those links in the show notes, everyone. I will definitely include all those links in the show notes so you can reach Jackie should you need to or want to, or just hang out and subscribe to her podcast, listen in, and look around her website. Jackie, thank you so much for being on the show today. I super, really appreciate it.
Oh, thank you. It's my honor. I really appreciate you asking me, Jill. I think the world of you.
Have a great day. Me too, you, Jackie. Don't forget to head over and get the show notes at jillcastle.com/010. That's 010 for episode number 10. I will have a bunch of links and resources to Jackie related to what we discussed today there for you. If you enjoyed today's episode, there are a few things you can do to help the Nourished Child podcast grow. Write a review on iTunes, subscribe to the show, and share the podcast on social media. Wherever you hang out, let your peers know about the Nourished Child podcast. The more parents that know about the show, the more informed and better at nourishing their child they will be. As always, thanks for joining me today. Please be sure to give that child, big or small, in your life a big squeeze today. Bye for now.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.